Digital literacy remains a challenge in telemedicine, with many of the 160 million users this year struggling due to limited tech access or skills. To talk about this, we are joined by Gustav Augustin from Beamer and Frederick Tay from Joyce A. Tan and Partners. Frederick, what changes have widened the digital literacy gap in telemedicine for patients?
A lot of the users, this telemedicine is actually potentially the sort of the aging population with chronic illnesses, in which case they might be struggling with the increasing more advanced platforms in which telemedicine is being delivered. Also consistent with that theme is the potential unequal access to connectivity that sort of requires to fill up all these platforms. With the internet connectivity changing and evolving over different standards and different streams and the high intensity of the data usage of the platforms, families who are not able to access to faster and quicker internet will also increasingly be marginalized as a result of this.
From our perspective at Beamer, we operate in emerging markets, and many of our customers are in the rural areas. So kind of access to smartphones and mobile internet is not always there. So what we do with all of our telemedicine services is that we also offer them through regular phone lines, so you don't have to download an app or have data connection to connect with the doctor through us.
Frederick, which patient groups face the greatest challenges with digital literacy in telemedicine?
Largely, there are two patient groups, in my view, that would likely be sort of marginalized as a result of the usage of telemedicine. The first one would be the largely aging population, because telemedicine does have it's one of the focus target groups. Patients with, for example, chronic illnesses for follow-up consultations. So the other patient group would likely to be the low-income patient groups who do not have access to faster internet connectivity or the latest, tools to engage into the more advanced platforms that's been rolled out for telemedicine as well.
So yeah, I agree with Frederick. I can also add that as the other groups are people who struggle to see, hear, or speak, or people with learning disabilities. Then I think also for us at Bima, operating in Africa and emerging Asia, also the kind of connectivity issue is a critical one. And if you look at sub-Saharan Africa, 70% of the population actually don't have access to internet. So this is a huge group as well. Also in our markets, we have a lot of people who can't read, and they primarily use local spoken languages, which are different from the written languages.
Frederick, are there regulations requiring accessible telemedicine tools for patients with low digital literacy?
Currently, right now, there are some legislative frameworks that do regulate the delivery of telemedicines. In fact, just to take the opportunity to clarify, in Singapore, when you look at the legislations that regulate in some form telemedicines, they actually regulate them under a larger category known as telehealth. Telehealth is actually much wider than telemedicines because it includes wide-ranging uses such as education and administrative. So sitting on this legislative framework about telehealth and telemedicine, there are currently right now no specific regulations that deal with making accessibility such platforms to patient groups which are digital illiterate, unless to such extent that the failure of making those accessibility affects the delivery and quality of the services.
I think if you look at our countries where we operate, there's no specific regulation for this purpose, but we look, for example, at guidelines that are provided by WHO. If you look at these guidelines, they're kind of outlining requirements on the platforms to serve all groups of customers. But again, as I mentioned earlier, so many of our customers don't even have internet connectivity or can't even read. So for us, we need to go a bit further than that and also offer telemedicine services through just regular phone lines as well.
Frederick, finally, how can telemedicine platforms be designed to better support digitally inexperienced users?
So one way would be to ensure that the primary givers of the patient groups are also familiar with the utilization and usage of the platforms, which also means that, hopefully we could see or expect to see user-friendly platforms that's being rolled out to help with primary caregivers. And when the design of the platforms, they should consider, when we look at patient centricity, ensuring that the platforms are not just looking to support for patients, but also the ecosystem that supports the patients, like the primary caregivers. It would be good if the design of the platforms could be such that they actually rely less on heavy internet connectivity resources to better support these patient groups as well.
I agree with Fredrik's point around user-friendly interfaces, and then also just want to highlight the importance of languages. So in our markets where we operate, we have many different local languages. So we basically need a panel of doctors to speaking different languages in order to serve all the patients. And then, finally, again, also around the connectivity question, I think the platform need to have the option to connect patients with doctors through the app using video, but also regular phone lines for those who don't have stable internet connections or smartphones.
Gustav and Fredrik, thank you both very much for joining us today.
Thank you very much, Simon.
Thank you so much, Simon.
Once again, our guests were Gustav Augustin, founder and CEO at Beamer, and Fredrik Tay, director of Joyce A. Tung and Partners. For more news, please visit healthcareasiamagazine.com.